You are listening to Living with ADHD and CPTSD, available on Apple Podcasts and other podcast platforms. Hello, everybody, and welcome to another edition of Living with ADHD and CPTSD. Today's episode is going to be about an ADHD episode, of course, but more specifically about oppositional defiance disorder. I did discuss it briefly in my live episode that I had a couple days ago, and so today I am going to elaborate on it much further, as it is affecting me directly, so I have my own experiences with oppositional defiant disorder. So, oppositional defiance disorder is something that a lot of people who have ADHD can, have as another disorder on top of it. And I have a lot of experience with it because it is something that's been going on pretty much the entire time that I have known about having ADHD. And it's something that I think a lot of people probably don't know as much about. And I really think they should know way more than what they're currently aware of when it comes to ODD. All right. What does oppositional defiant disorder look like in adults? An adult with oppositional defiant disorder, ODD, may feel mad at the world and lose his temper regularly, even daily. This may manifest as road rage or verbal abuse. It may cause tension with authority figures and trouble at work. It may tear apart relationships. Here's what you need to know about oppositional defiant disorder and its overlap with ADHD. Excuse me. So, ODD in adults. Adults with oppositional defiant disorder display a pattern of negative, hostile, and defiant behavior that lasts at least 6 months and includes 4 or more of the following symptoms. Often loses temper, often argues with family and coworkers, actively defies or refuses to comply with rules and laws, deliberately annoys people, blames others for his or her mistakes or misbehavior, easily annoyed by others, angry and resentful, and spiteful or vindictive. Adults with ODD are more than just aggressive and irritating from time to time. They feel mad at the world every day and lose their temper regularly. This may manifest as verbal abuse or road rage. Adults with ODD defend themselves relentlessly when someone says they've done something wrong. They feel misunderstood and disliked, hemmed in, and pushed around. Constant opposition to authority figures makes it difficult for adults with ODD to keep jobs and to maintain relationships and marriages. They are particularly quick to anger, they are impatient, and they have a low tolerance for frustration. They see themselves as mistreated, misunderstood, and unappreciated. They see themselves as the victim rather than the cause of the pain in the family system. Causes of oppositional defiant disorder in adults. ODD has a strong genetic component. It runs in families, and several people in the same family may be affected. It often begins in childhood with patterns of rebellion against adults and their rules. Some children with ODD outgrow the condition by age 8 or 9, but about half of them continue to experience symptoms of ODD through adulthood. People with ODD report feeling angry all of the time, and about 40% of them become progressively worse and develop antisocial personality disorder. Understanding ODD can help provide a neurological explanation for gut-wrenching feelings and is an important first step to finding treatment. Symptoms of the oppositional defiant disorder in adults at home. Your spouse seems overly argumentative. Your roommate is unnecessarily hostile. These and other common manifestations of ODD may be apparent at home. always need to win the argument with a parent or spouse, continues to fight against the man, authority figures, and society, leaves socks on the floor just because he knows it annoys his roommate, cited for disorderly conduct by police, involved in bar brawls or physical altercations in public, has a hair-trigger temper, the littlest thing can set her or him off. Symptoms of oppositional defiant disorder in adults at work. These or similar manifestations of ODD may be apparent at work. Near constant arguments with a boss or coworkers, commonly feeling oppressed by office rules, purposely engaging in behaviors that irritate coworkers like eating smelly foods for lunch, sanctioned by human resources for violating company policies, fired for being physically aggressive with coworkers in heated moments, has meltdowns during meetings or annual reviews after receiving constructive criticism. If you do experience these or similar symptoms of ODD, best is to consult a doctor or a mental health professional for a formal assessment. So yeah, this is very true. I have probably what you would call a very mild oppositional defiant disorder diagnosis. I'm not officially diagnosed yet, but the thing is I don't do certain things, right? Like, it's not, I don't go out and defy law, like the law enforcement. I don't do those things at work. It's definitely not something that I do. But it also can be in a way where you always question and disagree with things. Like, my worst habit or my worst symptom of it is when my girlfriend has a question or like questions me on something, or it says that I've done something, or it believes that I have done something, I am automatically responding with a disagreement, and the tone tends to be a defiant tone or somewhat of an angry tone or a annoyed tone, and I'm automatically basically disagreeing and I'm being defiant. So and it isn't necessarily verbally either all the time, it sometimes is in physical ways too. So if I'm trying to do something, let's say I'm trying to put the garbage into a bag that's the wrong bag, like type of bag, and I'm supposed to put it in the black one instead of the recycled bag, and she calls out and says, no, don't put that garbage in the blue bag, put it in the black bag. And it's like I hesitate to follow the instruction, and I've even at times would say I am, or I don't want to, or no I didn't, or I don't think so, or you're wrong. It's the way I am constantly responding to everything. She says that I have this thing where I disagree with everything she says, or I am being defiant instead of thinking and allowing myself to slow down and actually think about the response. And so this is something that's been going on for a long time, and it's a daily occurrence in me. And there's, from what I've been told, there is ways, or there are ways that you can resolve this. But the thing is they do say that you need to try and take care of it at a younger age, because if you do it early, you have a much better chance of stopping it. Okay, so how common is ODD? So according to a 2008 review, experts estimate that between 1 and 16% of children and adolescents may meet the criteria for diagnosing ODD. The condition seems to appear more often in boys before adolescence, but at roughly the same rate in people of any gender during adolescence and adulthood. The evidence supporting its prevalence in boys, however, is somewhat inconsistent, because in a 2011 study, some experts suggested using different criteria to diagnose ODD in girls who might display symptoms differently than boys. And with symptom overlap, some of the signs share similarities with traits associated with other conditions. including ADHD, conduct disorder, depression, bipolar disorder, disruptive mood dysregulation disorder, and antisocial personality disorder. This overlap can make it more difficult for experts to identify ODD in teens and young adults. It is also worth noting that some of these behaviors are pretty common during the teenage years. As a result, parents and teachers might not always find it easy to tell the difference between milder symptoms of ODD and more typical teenage attitudes. How is ODD diagnosed? Only trained mental health professionals can diagnose it. To do so, they'll take several things into account. Is there a pattern? A diagnosis requires at least 4 symptoms of defiance, argumentativeness, anger, irritable mood, or vindictiveness. These behaviors need to happen consistently over a 6-month period, at least once per week for anyone over the age of 5, on most days for children under the age of 5, with at least one other person besides a sibling. These signs might include having frequent arguments with authority figures, adults, and peers, outright defying requests from authority figures, refusing to follow directions or comply with requests from authority figures, a habit of purposefully annoying others, a habit of blaming others for mistakes and misbehavior, frequently losing their temper and touchiness and becoming annoyed quickly. Are symptoms affecting their daily life? Before diagnosing, a mental health professional will also consider how the behavior affects daily life. ODD can cause distress for the person living with the condition and the people they interact with most often, like family, peers, and coworkers. Symptoms of ODD can have a negative impact on social interactions, family life, participation in school, performance at work, and an ability to hold a job. Are symptoms related to any other factors? The mental health professional will also first ensure that other symptoms aren't related to substance abuse, depression, bipolar disorder, and psychosis. They'll also confirm that diagnostic criteria aren't met for disruptive mood dysregulation disorder. How severe are the symptoms? When making a diagnosis, experts will also consider symptom severity. Mild symptoms happen only in one setting, such as home, school, or with peers. Moderate symptoms appear in at least 2 settings, and severe symptoms happen in 3 or more settings. Treatment for ODD. Prompt treatment can go a long way towards improving the symptoms of ODD and quality of life. Professional support can also help treat or prevent other mental health conditions that might occur with ODD, including ADHD, depression, anxiety, substance abuse disorders, and conduct disorder. Treatment usually involves some combination of the following. Individual therapy. One-on-one therapy with a mental health professional creates an opportunity to learn new methods of regulating emotions and behavior, including skills to manage anger and irritability, communicate effectively, control impulses, solve problems, cope with frustration and stress. Therapy also offers a safe environment to share and address potential contributing factors, including challenges with relationships at school or work, neglect or abuse at home, learning difficulties, ADHD, depression, anxiety, and other mental health symptoms. Social skills training can also provide an environment to learn and practice skills for interacting with peers respectively and more effectively. Family therapy. A therapist who specializes in family therapy can offer guidance on improving communication and strengthening relationships within the family. Family therapy can support all members of the family by teaching productive strategies for addressing and managing behaviors related to ODD. A family therapist can also offer parents more support with learning and using effective parenting techniques, including consistent discipline and positive reinforcement. Parent training. Treatment for ODD might also include programs specifically designed to teach parents new skills to more effectively interact with their children and provide more constructive discipline. A therapist might teach these skills directly or through on-the-spot coaching. Some popular parent training programs include parent management training, Incredible Years, parent-child interaction therapy, and positive parenting program. Interventions at school. Support at school can also benefit students with ODD. This can come from teachers, guidance counselors, and other school staff. School interventions might include offering breaks when needed to give the student space to manage feelings of overwhelm and frustration, Changing classroom seating. Help connect the student with supportive peers, encouraging positive behavior in the classroom and with peers through positive reinforcement. Creating a plan to support any learning difficulties and mental health symptoms. School-based mental health support. Regular check-ins with a teacher or other trusted adult. And then medications. No medication specifically treats ODD. Still, some medications can help address co-occurring symptoms that may complicate treatment, including severe anxiety, depression, ADHD, and disruptive behaviors such as aggression. Any of these could make ODD worse and affect overall well-being. When symptoms don't respond to therapy, medication could lead to enough improvement that therapy becomes more effective. A psychiatrist might prescribe antidepressants, mood stabilizers, antipsychotics, and stimulants. Complications. ODD often improves as a child gets older, especially when symptoms are mild or moderate. Both family support and therapy can make a major difference in whether ODD improves. Without professional treatment and supportive parenting, ODD symptoms often get worse. People within the condition may find it challenging to maintain social relationships, have regular conflicts and other problems at school, have difficulty succeeding at school or work. Teens and adults with ODD may experience substance abuse disorders at higher rates and have a higher risk of attempting suicide. Here's how to support someone thinking about suicide. Conduct disorder, that's nothing to do with it. Conduct disorder, another mental health condition typically diagnosed in children, is another potential complication of ODD. Some children with ODD go on to develop this condition, which involves more severe and aggressive behavior. Conduct disorder also serves as a risk factor for antisocial personality disorder. Treatment and support for ODD can help improve symptoms and lower the likelihood of developing either conduct disorder or antisocial personality disorder. What is the difference between ODD and conduct disorder? Conduct disorder involves behavior that consistently violates rules, social norms, and the rights of others. People living with conduct disorder don't just show anger, irritability, and defiance. They often break rules and laws, show aggression towards people and animals, and deliberately destroy property. ODD might involve some destruction of property, but this generally happens during an outburst rather than intentionally. Someone might angrily throw a classmate's toy without intending to break it, for example. While evidence points to brain similarities between the two conditions, experts continue to diagnose them separately. Still, researchers recognize ODD as a key risk factor for conduct disorder. Strategies to manage oppositional defiant disorder. Okay, so before I go into this part, I am going to take a break. And then when I get back, I will continue on with this episode and talk about strategies to manage ODD. All right, I'll be back shortly. Hi everybody, welcome back to Living with ADHD and CPTSD. Once again, today we are talking about oppositional defiant disorder. And I'm going to go straight into the next part, which is strategies to manage oppositional defiant disorder. All right. So, along with therapy and other supportive approaches, a few key changes can help improve ODD symptoms. Parents can support their children by increasing positive reinforcements and reducing negative reinforcements, providing consistent consequences for misbehavior, using predictable and immediate parenting responses, modeling positive interactions in the household, taking steps to reduce environmental or situational triggers like overstimulation, lack of sleep, or stressful routine changes. Teens and older adults might find it helpful to get more comfortable accepting responsibility for mistakes and impulsive actions. Work with a therapist to learn skills for managing emotions and navigating conflict. plus get support for any co-occurring symptoms. Practice mindfulness and deep breathing techniques to help calm anger in the moment. Try new stress-relieving activities like exercising, spending time with friends, or enjoying hobbies. And create a self-care routine to better support overall well-being. Okay. Yeah, this is really good. I did read a lot of it that was regards to children, not just adults, because a lot of people do develop this as a young child, and if it's not taken care of, they can have it, come with them into adulthood, and by then they're already extremely, in an ODD form, and it's very difficult to stop it, I guess you could say, or make it less of a thing. I haven't really thought about it too deep because of the fact that I'm dealing with so many other issues in my life these days. But when I think about it, just even to a certain degree, I never had it initially as a child. I'm like 4 or 5 years old. It came slowly over time, and I do recall, and I'm not very proud of myself. When I think it was 5, I was in a shopping store. We have a place in Canada called Shoppers Drug Mart, and I don't know if they're in the US. If so, great. But anyways, there's this. I was in with my mom, and she was doing her thing, and I was not being supervised. And I found in one of the aisles a bunch of makeup, women's makeup, of course. And basically what ended up happening is I ended up ruining it. Like, I got into a bunch of packaging, and I ruined a lot of makeup. And I know I'm laughing because I just realized how silly and ridiculous the fact that I did this when I was a young child. And the thing that I remember the most, although it's vague because that was a very long time ago when it did occur, I remember my mother trying to get me to apologize and say sorry to the manager of the store, and I refused. I did not want to apologize. I was being stubborn. I was being outright ridiculous, and I refused to apologize. I really don't know or understand why I did that. Like, I don't even know why I did the thing in the first place, why I wrecked all that makeup. I don't quite get where that came from. I wasn't exactly the best disciplined kid when I was young, especially at 5 and 6 years old. I got into a lot of trouble at school and at home, and I guess that was just a sign of issues and disabilities that I had back then, but no one really understood that's what was going on. But I truly don't have any idea as to why I was so stubborn and refused to apologize. The only thing that I can really think as to the reason why is that I was already suffering from oppositional defiance disorder. And it was just me refusing to, admit that I did something wrong. And I don't remember a lot about it. I do know that I was banned from the store. I was not allowed in at any point. So whenever my mom had to go to the store, and of course, at a certain age, you're not allowed to be left at home, I had to come with her, and she left me in the vehicle. And I had to stay. I was not allowed in the store. And I know I got into a lot of trouble. I got into deep shit with my dad, of course, because that's just the way it is when your mother's going to tell your father about the ridiculous thing that I've done. And of course, I got into big trouble. Now, eventually, things changed. I can't remember what age I was. I think I was like 13 or 14 when I finally decided to try and go into the store. And of course, the manager was no longer there. It's not like they had my picture up on the wall saying, "Don't let this kid in." And I just remember going in and being like, are they going to recognize me? I had no clue. And it was really bad. And the other thing that I remember, I was 8, and this was, I could have gone either way, I suppose. I just remember I was in Saskatchewan visiting family, and it was just my mom and myself and my brother. And I was with a cousin of mine who's a couple years younger than myself. And I don't know why I did this. I guess I was just being a really bad kid. And I just remember we found this used car lot that was in the corner of the street. And I'm so embarrassed. Like, I know it was a long, long time ago, but even when I think about it, it's so embarrassing. And I regret doing it. We vandalized a lot of the cars. We removed like the logos and the little like labels saying the name of the vehicle. And I stupidly I almost got away with it, but I walked, I think there was a police car and the owner of the place was there, and I walked like curious, acting like, oh, what's going on? And they caught me, and I didn't think I'd get caught. Like, it was pretty vague, and I just remember I got into so much trouble. They took me down to the dealership, and the owner of the dealership was like threatening to put me in jail, and I got really scared, and I was like terribly frightened, and so deserved. I should be. In a way, I guess I was being oppositional, like I was being defiant, like I was, reaching out, trying to gain attention or something. And it was probably due to all the stuff that I'd been going through. I was a very curious kid. I did a lot of stupid things back in those days, but that truly straightened me out. It straightened me good, because all I knew is that I couldn't do that. The thought of going to jail, and to matters worse, it was, oh crap, I have to go home and I have to face my dad. That was the worst part, and it straightened me out. It's just, I never truly grew out of it. And the reason is because they never knew. They had no idea that I suffered from ADHD, that I suffered from, I likely suffered from autism and ODD at the time. And I never ever saw a therapist of any sort. Like, I remember seeing like a social worker in school when I was in grade 6, but that only didn't last very long. I was having a lot of troubles in school. But anyways, that's besides the point. I just remember I was always to some degree defiant, and from what I've learned and a lot of reading that I've done and research on ODD, is someone whose brain is not properly developed, who has ADHD, or even like the autism that is there that I'm suffering from. Your brain has a hard time staying at the correct speed, or having it not capable of slowing down in intense moments, or sudden intense moments, like someone criticizing or questioning you in a specific tone, going, "Don't do that," or "Why'd you do that?" or "Don't," like they're being like authoritative. And I instinctively, because of the fact that I don't have the ability to slow down and to think and to pause, it's like an automated default, instant, immediate reaction. And it happens so fast, and it's so common, and it's such a default mode that the ability to recognize it in the moment when it's occurring is near impossible. Like, it just happens. Like, it's like a snap of a finger. It's there. It's done. And it's before you know it, you've already annoyed. Like, I already have upset my girlfriend because I've done it, and it's she's very upset because it just keeps happening, right? And I don't know what to say. I honestly don't know what to think in the moment after it occurs, and I'm already heightened because of my conditions, and with the trauma, there's a real good chance in the moment that I'm going to get triggered, and then I'm just going to be useless. Or at this point, I'm going to have an autistic meltdown, and I won't be able to speak. I'll just repeat the same things. It'll just be nonsense, and I'm done. And imagine all the disabilities that are playing into each other at the same time: the ADHD, the CPTSD, the autism, and then you got the oppositional defiant disorder that is playing in there as well. It's pretty messed up if you think about it. It's not good. And the only way I can get any effect or make this any better is by seeing a therapist. And I am already seeing one. The problem is it's explaining it and giving a good diagram or a good explanation of how this is happening or what's going on in the moment, because I am so forgetful and I can't remember most of what I want to talk about. And I end up kind of rambling and going on about one or two things for the entire session. And there are important details that are getting missed. So I have to take a different approach. I have to, instead of talking about a bunch of different things, it's got to be maintained about talking about ODD with my therapist and going through and practicing techniques and building new techniques and adaptations that when the opportunity or the possibility of having, being defiant or having the ODD symptoms occur, you have a better chance of slowing down, like the situation that you're having occur, slow down and be able to think and pause as enough so that you'll be able to, instead of going, no, I didn't, or, like hesitating, making movements and not listening to the person in the moment, having a better chance of actually doing it. Making the steps, right? Like taking the proper steps to getting out of that habit and correcting that behavior. It's obviously going to be extremely difficult to correct because it is something that is genetic and neurological in your brain. So you can't just suddenly change overnight. It has to be effective work through therapy repeatedly and over time, and a lot of practice and just being patient. You as the person who has ODD has to be very patient in order to be able to have any shot at improving this condition. It's not probably going to fully go away, of course, but you have a better chance of developing alternative ways of responding or reacting to someone who's questioning you or being sudden with the improper tone or that angry tone that they present, which is what triggers it. Being very poor at self-awareness, it is difficult for me to recognize it just as it is. I am already getting better. I haven't even started therapy work with it, and I'm already getting better because I'm really trying very hard every single time to resist, to stop myself from giving that default action. And it's a slow process, but it actually is working. This ODD is a major hurdle, especially in my relationship. Like, we've gotten a pretty decent grasp on the CPTSD. We understand the ADHD, and we're happy with that. We are working on it. The autism is something that we have to get diagnosed so that we can get proper training and proper adaptations built into that. But right now, the major conquest that is really causing a problem is the ODD. The oppositional defiant disorder is really having a lot of problems in our relationship because of the fact that it's so difficult to stop. It's not a simple thing, right? Like, unlike the other diagnoses, unlike ADHD and CPTSD, you can work with it by creating adaptations, getting routines built, processing, using grounding tools. With ODD, you can't really do that. You can't process with ODD because it's not that sort of a disability. You can't build a routine because it's not that kind of a disability. It's a completely separate sort of setup, and it's so quick and so reactive and so instant. Once it happens, you either have to practice in the moment and work on alternate responses, and your partner or the person that you're working with has to be capable of being very calm and not allowing themselves to get upset or raise their tone of voice or the volume of their voice, because that's just going to set it off and make it worse. Your partner or your wife or husband or girlfriend, boyfriend, or even a best friend has to maintain a certain level of calmness and supportiveness and be patient and be willing to go through this so that the person will learn over time that it's okay, that you're not in danger, and that you don't have to be defiant, you don't have to resist, you don't have to fight back against authority. It's a struggle, and it's going to take some time and effort to get through it. I definitely recommend therapy work because otherwise it's going to be very difficult to do this, right? Like, you can't really do it on your own. It's extremely difficult because we're not experts. We don't know how to deal with it. No, we really don't. And that's just one of those things. Yeah, so just gonna go over something here. ADHD signs and oppositional defiant disorder. Attention deficit hyperactivity disorder is a condition that causes inattention, impulsivity, and hyperactive behavior. ADHD is the most common diagnosis to co-occur with ODD. Both ODD and ADHD can cause impulsive or aggressive behavior. One condition may be mistaken for the other. This can lead to misdiagnosis and inappropriate treatment. As we all are aware of, ADHD signs include trouble paying attention, constantly being in motion, easy distraction, excessive talking or difficulty listening to others, and difficulties at school. Attention and focus problems are not a characteristic of ODD. So, when a child also struggles with attention, the problem might be due to ADHD or ADHD co-occurring with ODD. So there you go. It is difficult to properly diagnose at times. A lot of people can get ADHD and ODD mixed up, but that's why only a specialist and a certified therapist or a psychiatrist can truly diagnose whether it's ODD or whether it's ADHD. You just have to be patient, and you have to understand the process of getting through in order to get the correct diagnosis. If you can do that, you're on your way. Well, that's it for today, folks. My Twitter account is ADHD and CPTSD. Please come on Twitter and take a look. Give me a shout. Follow me on Twitter. If you want to message me, I am open to talking about anything. My website is www.livingwithadhdandcptsd.ca. You can check out my YouTube channel. It is starting to build. I do have some videos on there, and I am going to add more and more throughout the weeks and the months coming up. And I would really like you to subscribe to that and keep an eye out for new videos. I'm still looking to interview some people and some experts and other people with ADHD or CPTSD. I really hope you'll join me. Spread the word in regards to this podcast. If you know of people who are into learning about ADHD and CPTSD, or you think they may have it, I definitely recommend showing them this podcast. Tell them what it's about. Show them all the episodes that I've created so far. I think they'd be very happy and might be something that would be helpful. I recommend it. I've had a lot of good word from people. I get increasing views and listens, and I would love to have more people find out about my podcast. So spread the word. Tell people about it, and more people can get the help they need and feel encouragement and hope that they too are able to get the help they deserve. All right, everybody. That's this episode. Stay tuned for tomorrow's episode on CPTSD, and have a great week. Bye, everybody.